Dr. Cindy Collins, and I'm a health psychologist and also a registered dietitian. So the nutritional requirements for a cancer patient can be very different depending on the type of cancer, but almost always we know there's an increased caloric need. Cancer itself is a very fast growing thing. It's using a lot of fuel in the body. So typically we need more calories than we normally would. And then you have the other issues of certain types of treatment like chemotherapy or radiation treatment may make it that you need more calories. You also, in some cases, are at a great risk for losing a lot of weight. So it's really important that you keep up with the nutritional needs and also watch your weight at the same time. Additionally, if you have cancer that affects perhaps the mouth or the throat, maybe even the esophagus, other organs and tissues that deal with eating, you might have special needs where it's more difficult to get your nutrients. So at that time, if you see a dietitian, they'll figure out for you exactly what your calories are, given the time you are in treatment, as well as your carbohydrate, protein, and fat needs. So when it comes to protein, I think probably that's the one macronutrient that is most paramount because protein is really important for healing, for making antibodies, for making scar tissue. You actually hope to never use your protein for calories, so it becomes paramount in nutrition therapy. So your dietitian is going to look very closely at your protein needs and also at your ability to digest and absorb the protein that you are eating. Carbohydrates are super important as well because you need your fuel from carbohydrates and specifically so that you're not using your protein for your fuel. And a lot of patients, they really do forget to pay attention to the healthy fats, and there is such a thing as healthy fats. They're very important for so many different functions in the body. And it turns out that that also would be figured out in your needs. So the calories, the carbohydrate, the protein, the fats, especially your essential oils, and then we fall into the micronutrients. Micronutrients are your vitamins and minerals, and they're extremely important for all the different chemical reactions that go on in the body, and they're going to be especially important while somebody's undergoing cancer treatment. There are some people who are concerned about getting too much or too little of certain nutrients, and in certain cancers, even gaining weight can become an issue. So that's why it's really important to see your dietitian for your specific cancer and get a dietary module or a way of eating that would be specified for you and for your needs.